Welcome to my series of videos on low biologic cost dental care. I'm Alex Husty, the Principal Dentist at Belle Dental Valentine. This is video 4 in the series. It draws on some of the concepts around low biologic cost presented in the previous 3 videos. I would encourage you, if you have concerns around your teeth or dental care, to watch the whole series on low biologic cost. It contains valuable information that will help you decide what constitutes good dental care and what to look for in a dentist. Typically when patients present to my practice, they're often troubled with some form of breakage, pain or functional problem. These types of problems are really basic and should be largely avoidable. They often seek resolution of problems that are fundamental in nature, yet they have never transitioned from solving fundamental problems to a place of comfort, cosmetics, and long-term stability. It would appear that many of these patients haven't been given education around their problems, and the problems have not been dealt with in a long-term or permanent fashion. You could say that they're suffering from a lack of prevention of problems. Prevention and education are the keys. Yet no planning or delivery of these kinds of preventative services can be provided in a 15 to 30 minute appointment squeezed in with other treatment. So let's see if we can offer you a better way to dental health. The Belle Dental experience. Most of our new patients initially present with pain, repeated failure or some form of dissatisfaction with their dental care, including just a lack of proactiveness in their examinations. At this first visit, we will either deal with the emergency or do our primary examination as outlined in the free consultation video. So once we have relieved the primary problem and conducted our primary examination, which includes a discussion of your concerns, we have enough information to formulate a plan of treatment. We can now make a further appointment to discuss the plan with you. This is a free visit. At Belle Dental, we call this a diagnosis appointment. At the diagnosis appointment, we will have a treatment plan developed for you. I know you have probably had this done for you before, but is the plan in priority order? Does it deal with fundamentals first? Does the plan address strategic teeth? Is the plan strategic in any way? And most importantly, does the plan arrest the deterioration of your teeth? Have you noticed that the most important things you need done are usually crowns or at least more expensive items? These procedures are usually not fundamentals. At Belle Dental, we firstly identify the strategic teeth and address these teeth with well-sealing, well-contoured fillings that will stabilise the tooth. After all, if your foundations are not excellent, how can you expect stability and beauty? The second most important thing to note is that we can allocate sufficient time for the treatment. At Belle Dental, we ideally want to address the problem once and once only. Our appointments with you are longer, but this way we can get more done for you at a higher standard. This is the secret to long-term stability. Thirdly, we break down your treatment into phases. Phases 1 and sometimes 2 deal with fundamentals. These phases deliver stability and basic cosmetics. Subsequent phases deal with more comprehensive dental care. But only once we have achieved primary stability. In this way we achieve long-term resolution of your problems and build a foundation for future care. Many of our patients are happy with the results achieved in phases 1 and 2. These patients are stable, have good home care, and their teeth usually only need to be checked once a year and x-rays taken every 2 or 3 years. However, many of these patients have never ever experienced true long-term stability and cosmetics. As a consequence of their newfound confidence and stability, many of these patients transition to having their more comprehensive dental needs met, simply because of the confidence in their fundamental treatment. So in summary, low biologic cost is about 1. Excellence in delivery of the basics, fundamental treatments. 2. Education about dental health and home care in order to prevent future problems. 3. Having a policy of being conservative of teeth. As much as you want to believe that modern technology is good, it's not as good as having your own teeth. And 4. Innovative treatment options tailored to your needs, not simplistic solutions that treat you as another patient in a process. Thank you for watching and listening to my series of videos on low biologic cost dental care. Your health is based upon the decisions you make regarding food choices, preventative health choices which include exercise, your choice of health practitioners which will vary based on your genetics and healthcare needs, and your healthcare treatment choices. I sincerely hope that this video series offers insight and methodology into how you make these important healthcare decisions. In an era when realistically there's an enormous amount of information regarding your healthcare choices, yet the decision around healthcare is ever more difficult because it boils down to one of the following. Oversimplification, you need a crown. Distraction, such as the dental day spa. Dentistry is healthcare, Disney is entertainment. Don't get the two mixed up. And last of all, understanding the true cost of your healthcare. If you found this series valuable and you feel you'd like to act on this information, feel free to contact me at Belle Dental Valentine. We're located at the shops at Sleepy Valentine. You can click down at the bottom of the page for a map, or you can contact us by phone on 02 49 46 9122. Our website is www.belledental.com.au, and there's a wealth of information including photos and articles on that website. Alternatively, a video outlining our range of low biologic cost treatments can be found also at the bottom of this page. Thanks again for your time. I'm Alex Husty, the Principal Dentist at Belle Dental, and I wish you health, happiness and real prosperity.